Have you ever wondered which exercise is truly better for building a strong, healthy lower back? Kettlebell swings or deadlifts? What I'm about to reveal will completely change how you think about these two popular exercises. Because the way they affect your lower back muscles is far more different than you might imagine. And in some cases, they can produce completely opposite results. I used to think these exercises were pretty similar. After all, they're both hip hinge movements, and they're both known for strengthening the posterior chain. But then I saw the groundbreaking 2024 research from Stanford University's exercise science department, and everything changed. This study followed 120 participants for 8 weeks, splitting them into kettlebell swing and deadlift groups, and the results were absolutely mind-blowing. Let me start with a real-world example. Meet Sarah, a 45-year-old office worker who suffered from chronic lower back pain. She started with deadlifts, training religiously for 6 weeks, but her back pain actually got worse. Then she switched to kettlebell swings, and within just 4 weeks, her pain decreased by 70%. On the flip side, there's Michael, a 38-year-old construction worker who saw minimal improvement with kettlebell swings, but experienced dramatic strength gains once he incorporated deadlifts. Why do these two exercises produce such different outcomes? The answer lies in completely different muscle activation patterns. According to electromyography research from the German Sport University, Cologne, kettlebell swings and deadlifts stimulate the same lower back muscles in fundamentally different ways. This isn't just about exercise intensity. It's about the actual sequence and pattern of muscle fiber activation being completely distinct. Let's examine kettlebell swings first. During this exercise, the erector spinae muscles maintain an average activation level of 65%. But here's the key: the activation time is extremely brief. We're talking about explosive contractions, lasting just 0.3 to 0.5 seconds that repeat rapidly. This is similar to a sprinter's muscle usage pattern: quick and powerful but short in duration. Deadlifts tell a completely different story. The erector spinae reach average activation levels of 85%, but the duration is much longer. Each repetition requires sustained contraction for 3 to 5 seconds. This resembles more of a marathon runner's muscle pattern: relatively lower intensity but sustained over time. But here's where things get really fascinating. The deep stabilizing muscles, particularly the multifidus, show remarkable differences. During kettlebell swings, multifidus activation averaged 45%, while deadlifts only managed 25%. The multifidus is crucial for spinal stability, and kettlebell swings activate this muscle nearly twice as much as deadlifts. This explains why chronic back pain sufferers often see better results with kettlebell swings. One of the primary causes of back pain is weakened deep stabilizing muscles, and kettlebell swings target these muscles more effectively. A clinical study from the University of Helsinki involving 80 chronic back pain patients over 12 weeks found that the kettlebell swing group experienced 40% greater pain reduction compared to the deadlift group. However, when it comes to pure strength gains, the tables turn completely. Maximum strength testing revealed that the deadlift group achieved an average 32% strength increase after 8 weeks, while the kettlebell swing group managed only 18%. This clearly demonstrates deadlift's superiority for raw strength development. Why do these differences occur? It comes down to the nature of the load. Deadlifts involve isometric contractions, where muscles generate maximum force without changing length. This contraction type is incredibly effective for increasing muscle fiber size and maximum force production capacity. Kettlebell swings involve rapid alternation between concentric and eccentric contractions. The muscle contracts and then relaxes in continuous succession. This contraction pattern specializes in simultaneously improving both power and endurance. Another crucial difference lies in nervous system adaptation. Research from UCLA's neuroscience department shows that kettlebell swings dramatically improve motor unit recruitment speed. Simply put, your brain gets faster at sending contraction signals to your muscles. This significantly enhances reflexive movements and balance. Deadlifts, on the other hand, increase maximum motor unit recruitment. You become able to recruit more muscle fibers simultaneously. This greatly enhances your ability to generate peak force instantly. Let's break down specific muscle responses. For the erector spinae, deadlifts primarily activate the thoracic region, showing an average 78% activation in the upper back. Kettlebell swings preferentially activate the lumbar erector spinae, recording an average 72% activation in the lower back region. The latissimus dorsi response is equally interesting. During deadlifts, the lats serve primarily as stabilizers, showing average activation of 35%. In kettlebell swings, the lats actively participate in the pulling motion, recording average activation of 55%. This suggests kettlebell swings might be superior for lat development. Glute activation patterns differ dramatically too. Kettlebell swings create explosive glute contractions with average activation of 82%. This is significantly higher than deadlift's 65%. The lateral stabilizers like gluteus medius and minimus also work more actively during kettlebell swings. Hamstring patterns are complex. Deadlifts create sustained hamstring contractions at average 58% activation. Kettlebell swings show explosive spikes up to 75%, followed by rapid relaxation. This difference means kettlebell swings favor hamstring power development, while deadlifts favor endurance. Here's a crucial discovery about intra-abdominal pressure. Research from Munich Technical University's Biomechanics Institute found that deadlifts create average intra-abdominal pressures of 180 millimeters of mercury, while kettlebell swings only reach 120 millimeters of mercury. Higher pressure aids spinal stability, but can cause blood pressure spikes and breathing difficulties. This explains why kettlebell swings are safer for people with hypertension or cardiovascular conditions. The American Heart Association actually recommends dynamic exercises like kettlebell swings over static loading for cardiovascular patients. Breathing patterns also differ significantly. Deadlifts often require breath holding during each repetition, using the Valsalva maneuver. This helps spinal stability but temporarily interrupts oxygen supply. Kettlebell swings allow natural breathing throughout the movement, maintaining continuous oxygen delivery. Now for age-specific recommendations. People in their 20s and early 30s can safely perform both exercises. If maximum strength is your goal, choose deadlifts. If you want functional movement and power development, go with kettlebell swings. From late 30s through 40s, consider your exercise experience and current condition. If you're experienced and injury-free, deadlifts can be part of a comprehensive program. If you have back discomfort or limited experience, start with kettlebell swings. For people over 50, safety becomes paramount. Kettlebell swings are generally the safer, more effective choice for this age group, considering decreased bone density and joint mobility. The dynamic nature of kettlebell swings offers significant advantages. Women have special considerations. They often have relatively less core stability compared to men. Rather than jumping into heavy deadlifts, building foundational core stability and hip hinge patterns with kettlebell swings for 8 to 12 weeks before introducing deadlifts is ideal. For pregnant or postpartum women, kettlebell swings are much safer. They create less intra-abdominal pressure, allow natural movement, and can be stopped instantly if needed. Here's a practical programming approach. For kettlebell swing-focused programs, train 3 times weekly for 15 to 20 minutes per session. Start with 30 seconds work, 30 seconds rest for 6 rounds in week 1. Progress to 45 seconds work, 15 seconds rest for 8 rounds in week 2. Then adjust based on individual capacity. Deadlift-centered programs should be 2 to 3 times weekly, 25 to 35 minutes per session. Begin with 60 to 70% intensity for 8 to 12 reps, 3 sets in month 1. Progress to 75 to 85%. Intensity for 5 to 8 reps, 4 sets from month 2 onward. A combined approach works excellently too. Use deadlifts on Mondays and Thursdays. Kettlebell swings on Tuesdays and Fridays. This captures benefits from both exercises. Nutrition and recovery differ between exercises. After deadlifts, protein supplementation is crucial. Due to greater muscle damage, consume 0.3 grams of high-quality protein per kilogram of body weight within 2 hours post-exercise. After kettlebell swings, carbohydrate replenishment is more important. Due to greater glycogen depletion, consume 0.5 grams of carbohydrates per kilogram of body weight within 1 hour post-exercise. In conclusion, kettlebell swings and deadlifts serve different purposes. Choose kettlebell swings for back health and functional movement improvement. Choose deadlifts for maximum strength and muscle mass development. Ideally, master both exercises and use them appropriately, based on your specific goals and circumstances. If this information helped you, please like and subscribe, and leave any questions in the comments. Next week, I'll dive deeper into detailed techniques and progressive programming for both exercises. Thanks for watching.